Thank you so much for having me here today. I grew up in Hamburg, Germany, but my family is originally from Kabul, Afghanistan. Hamburg and Kabul, two cities that couldn't be more different. In 2012, I traveled for the first time to Afghanistan, Kabul, with my father, and I was overwhelmed with a lot of feelings. On the one hand, I felt incredibly grateful to have had the opportunity to grow up in a city like Hamburg with equitable access to healthcare and education, providing an enabling environment to thrive. On the other hand, I was incredibly, almost angry and frustrated by this huge inequality. We must be able to create an enabling environment for everyone, no matter where they live. And providing major access to healthcare services is a major component to that. But currently, over 4 billion people lack access to basic primary healthcare services. And this global health challenge is further exacerbated by rapid urbanization, as you can see here in this children's hospital in Shanghai, where people are queuing for hours to then get an actual consultation time of 2 minutes. At Ada Health, it is our vision that everyone on Earth has access to the quality healthcare they need by bringing the future of personalized healthcare to everyone, by using the power of artificial intelligence and mobile technology. So how does this work? Ada is a personal health guide that is helping people all around the world to manage and understand their health. She's an interactive chatbot that starts first about your presenting complaint and then asks more and more and more until she has collected enough evidence to provide you with a probable cause and what best course of action to take as a next step. We spent over 7 years building our medical reasoning engine with over hundreds of doctors, AI scientists, and engineers, and we're able to compute, to link thousands of symptoms with over thousands of conditions to compute complex symptom constellations within minutes, not only guiding users, but also providing critical clinical decision support for health workers. Here you can see some of the examples of next step guidance, treatment options, guiding to self-care, or pharmacies or to your local provider. To date, Ada has roughly 6 million people, users all around the world using the app and is rated as the best medical app all around the world in over plus 130 countries. In addition to taking reported symptoms into account, Ada is also able to take into account risk factors, geolocation, and sensor data, which allows to generate highly precise, aggregated population insights that we can share with city governments and councils to support with helping to anticipate public health needs and supporting with outbreak control. This is, of course, very relevant when it comes to communicable diseases such as Lassa fever or TB that can spread very easily in an urban setting. We're able to see the rise of certain symptom constellations and can alert governments quickly. By becoming a maker in this challenge, we want you to help us to achieve this next level. We want to form a major partnership with a major city in the global south. Here, for instance, you see, for instance, Mumbai. We want to map all local care options into our system to provide a new digital front door to urban populations and connecting them more effectively with public and private primary health care. We want you to help us to show the world that Ada's AI can massively contribute in improving urban health and showing the tremendous potential of AI to create more scalable and repeatable solutions to mitigate the challenges of rapid urbanization. Thank you very much.
Thank you. Is there a built-in feedback loop when it gets to the provider?
To the provider?
Yeah.
Yeah. I mean, it depends. For now, for instance, we have partnered strategically with several types of, so for instance, large health systems or payers as well. And there, obviously, since we work with a partner, we can also get feedback in terms of how well is it working for them, what services have been used. We also constantly evaluate the user feedback that we get from our own users, whether it comes to what has been the pre-diagnosis to what type of next care options would they like to see. And for that, we have an in-house team that is currently reassessing that so we can further tailor that. But right now, we're providing, for instance, triage levels that are more broad-based. So for instance, seek emergency care. What type of emergency care then the patient is seeking is in their hands. But we can tailor this further and further and actually map, for instance, the geolocation of a specific provider when we know what that is.
Okay, thank you for your wonderful presentation. It was excellent. Can you tell me why you and your team will be a leader in the space of digital health in the future?
Because for us, it's really about personalized healthcare. And that is something where you're not able to just gain efficiency gains, but you can improve the quality of the overall system while focusing on the individual. So what's important for that respective individual with their risk factors, their genetic profile, their location, and using AI to be able to provide guidance for a specific user. So what's the right intervention at that point in time? And that's precision medicine, precision public health that AI is able to deliver, kind of. And that's really where we see the future of personalized healthcare and moving more and more, being able to also guide prevention, to provide prevention. That's kind of almost a new concept of how we want to deliver, how we can support delivering new ways of primary healthcare delivery.
Yeah, Ida. I'm almost going to call you Ida. But amazing branding, by the way. Very easy to keep in mind. What will you touch base on building partnerships if you got this award? Can you elaborate more how this award can help you scale this application and specifically going to markets like Bangladesh and like Afghanistan and like India, etc., where internet connectivity, smartphones, record management of a patient is not there, etc.
Yes, so I think if we all look at that wall there on the side, we see a huge network of UN agencies, of right people helping us to develop the right partnerships, because we see already there is global acceptance. So people, for instance, in India, we have 1 million users. People are using it without us doing any tailoring. But to really walk that next step and not have a standalone app, but build a bridge into the health ecosystem, we need to work with organizations from public health, multilateral organizations, local organizations. We need all of that, and that's a multilateral effort. No company can do that alone. And that's why becoming a part of this network would be very valuable for us.
And the money would solve that, or you need more help through the whole ecosystem?
The ecosystem and funding is also, in a sense, helpful that we could get started in piloting more tailored options and testing that. Let's say with a resource-limited population, Bangladesh or in India, we could pick a city, we could start working towards that. It would not, of course, be sufficient, but it would be starting point to start this and start engaging with these partners. Yes.
Thank you very much. I think you partly answered my question already, but it'd be great to get a deeper dive. So do you foresee kind of cultural resistance to this technology or to this approach towards medicine in certain places, and how do you plan to overcome that? Mm-hmm. And a separate unrelated question is just on data protection of users and kind of how you're addressing that.
Yeah. So data protection, I'll just start with that one, with the latter one. We're completely GDPR compliant and comply with all the highest data regulation standards that exists. And I think the beauty of GDPR is the data is really owned by the patient. And also, in addition to that, we're, for instance, making sure that personal information and medical information are stored completely separately, so that's unidentifiable, and that's also very, very important. If we look at some of the tendencies all around the world, how people are dealing with data. So that's really the core of us also as a European-founded company, and we apply that to our entire global user base. The first question was, sorry again, around the...
I guess I was just wondering whether you anticipate
yes.
user resistance, just because it's a new way of approaching.
So actually, we work very closely with also, for instance, physician networks that has helped us to build that, because initially the approach was to say, the first 5 years we said we want to build a system that is as good as that it can support doctors. So we've built it actually together with doctors for doctors. And then 2 years ago we said we can make this knowledge base available to people all around the world, and they can benefit from that. And there's two components to that. So when we talk to physicians, they're quite aware of the cognitive challenge when it comes to making a diagnosis, and that a lot of rare misdiagnosis is also happening. And that's simply because the human brain is not wired to be able to compute all of that. So there we receive actually a lot of positive support. So really experts say, yes, this is needed, and this can help us in our daily practice, which we have also done several prospective studies that confirms that. And the other case with the user is actually, it's also, you could think, for instance, a chatbot might be maybe impersonal, but we have some user feedback where users are saying, and a lot of them are saying, finally, somebody is listening to me, because Ada is just, she has no time pressure. She's just asking and asking and asking, and then providing guidance. And there's almost like a human element to AI that definitely has contributed to this global user base acceptance.